Hey, I'm Dr. Paul, and welcome back to the Chiropractic Education. It does several things. Number one, in all likelihood, it'll increase your business $100,000 a year within 90 days. That's very, very common. It'll get you paid because our patient education is based on the science of the three phases of healing relative to the patient's test. That's what the therapeutic protocol is based on also. So once you not only educate your patients that way, but you document that way, that's what gets you paid. That's what gets you paid by third-party reimbursers, and that's what stops fraud, is when you document your patients that way. These are all the big things that it does, and it gets people to accept care. And one of the biggest concepts is that we're not pushing a philosophy on a patient. You know, it's like if you went to the dentist. Do I really care about the founder of dentistry? No. Do I really care about the philosophy of dentistry? Not at all. Well, that's exactly the way patients are. So we don't do that with our patient. Our patient education is patient-centric. In other words, it's totally based on the patient, not my profession. Meaning, it's totally based on how they're going to heal. And that's called the science of the three phases of healing relative to the patient's positive biomarkers or test. That's what their therapeutic protocol is based on. That's what their treatment's based on. And they totally understand and accept that. Because now it's about them. It's about them, not about me. And that's a huge, huge difference. So we talked in the previous video the importance of understanding motivation. We talked about pleasure, logic, fear as part of the education. We're always going to talk about where we want to take them. In other words, what they want, where they want to go, not where I want to take them. They want not only their symptoms to be free, but they want their primary ADLs to be back to normal. That's overwhelmingly what patients want. That's the pleasure. Then there's the fear. That's the highest motivation, remember? And that's essentially, with the patients, it's the possibility of healing with a permanent injury for the rest of their life, which will happen if they do not receive the proper therapeutic protocol during each of the three phases of healing. And then there's the logic, okay? How are you going to get from point A to point B? Well, that's the therapy. So we explain pleasure, logic, fear, see? And we let the patient make decisions. And it's amazing how much of them definitely want to get better and get back to their primary ADLs and don't want a permanent problem the rest of their life. It's actually common sense, to be honest with you. And then all we have to do is make it affordable. We have to deal with the two big obstacles, time and money. And there you go. You got a long-term patient. And by the way, they're getting the exact care that is required based on the science of the three phases of healing and their test. So we talked about the 4 steps to the purchase cycle. That if you violate that, there's needs analysis, presentation, obstacles closed. That's how we want things delivered to us when we buy products and services, whether it's a candy bar at the cashier or it's a house. The difference is just how long it takes. The same psychology happens. So that's the way we process the patients. We'll make sure the needs established first. We'll go to the presentation that has pleasure, logic, fear. Then we'll handle the obstacles of time or money. See, this is what they want. So then we go into the 4 most important questions. Again, these are the questions they want to know consciously and subconsciously, and they want to know them in this order. So again, if you're not answering them, or you're not answering them in this order, you're creating a paradigm shift. You're violating their trust. You're increasing the defensive reaction. In other words, you're losing patients. So that is, what's my problem? Can you help? How long is it going to take to feel better? How much does it cost? So all of these are integrated. So remember, every time we're interacting with our patient from the first few days, there's 3 components in that particular day. There's the clinical component, there's an administrative component, and then there's a patient education component. There's 3 different components within each of the first few visits. Okay, so let's go into the stair step. This is unbelievably important right here, the stair step. So what we do is we've taken this four-step process right here, the natural four-step purchase cycle, and we moved it right into the patient education. In other words, our patient education is 4 days, and it's phenomenal when you understand how each day is set up. Now, that does not mean we don't treat the patient, and there seems to be a lot of confusion with this, that we don't know. We'll treat the patient, but what you do or say and how you say it and when you say it is unbelievably important. In other words, on day one, it's a very fresh relationship. It's a very fragile relationship. So I got to be real careful about things that I do and don't say. It's called present time consciousness. But essentially, we'll have 4 days. Day one, there's only one objective of day one. We'll establish need, start to answer the presentation, start to answer the 4 questions. What's my problem? Can you help? And then the only goal for the obstacles of time or money is 1 day, is just to get them to the next day. That's it. We don't talk about 3 days. We don't talk about a week. We don't talk about treatment schedules. We don't talk about maintenance care. Okay, that's called a violation of trust. That's called a paradigm shift when you start doing that. There's only one goal. It's to get them to the next day. It's a baby step. Because the relationship is so fragile. It's like going out on the first date. You wouldn't ask the person on the first date, do you want to get married? That would destroy the whole relationship. Well, it's the same thing with a patient. I'm not going to start talking about treatment plans and maintenance care on the first visit. The relationship's way too fragile. There's only one goal, is to answer those basic questions. What are my established need? And start answering the questions they want them. What's my problem? Can you help? How long is it going to take to feel better? How much is it going to cost? But it's only that day. We're not talking about treatment schedules with time or money. So we're talking about very small amounts of money, very small amounts of time. And remember, those are the 2 big obstacles. So we'll put it into 4 steps. So day one, when they come in, we'll do the consultation exam. We'll do some therapy if necessary. If we need to chiropractic treat them, we will. We generally don't. Give them an adjustment on the first visit for clinical reasons and practice management reasons. Day 2, we'll treat them. Therapy, adjustment, whatever. Day 3, we'll treat them. Day 4, okay. So the therapeutic protocol is pretty straightforward. But the report of findings is on day 4 because we stair-step the patient. We can't overwhelm them. So we're going to use what we already know about how people buy. So on day 1, we're putting a lot of emphasis on establishing need and starting to answer the 4 questions. The only goal for time and money is to get them to commitment for day 2. So they come in day 2. So we give them further information on what the problem is, can we help, how long is it going to take to feel better, what's it cost, and then we're only going to ask for 3 days. 3. We're not going to talk about maintenance care, lifetime care, none of that. Remember, the relationship is still too fragile. So to blow up time or money, to ask for a lot of time or money. And then we're following the formula. We've already established need on 1. We'll continue it on day 2. We'll do the presentation. You see, so we're following the formulas each day. And then what's the natural byproduct of each day? Well, the natural byproduct is trust and confidence goes up, defenses and resistance go down. As a matter of fact, I tell chiropractors all the time, if you just did your report of findings on day 4, because remember, we buy in a 4-step cycle. Need, presentation, obstacles, close. If you just separated out and talked about, did your report of findings on day 4 and did nothing else, you would significantly increase the people who accept the care because their defenses and resistance are much lower on day 4 than day 2. And their trust and confidence is much higher. I mean, that one little concept alone. Now, there's a lot of concepts in ours, but that one little concept, okay? And by the way, just so you know, when you look at each contact, the greatest jump in trust and confidence is between the second contact and the third contact. So if you're doing a report of findings on day 2, you're throwing big paradigm shifts at the patient with the obstacles of time or money, with not having to establish the relationship or the need very well, and violating the natural purchase cycle. That's why it's very difficult to get people to prepay on the, or accept long-term care, time and money on only the second day. That's like asking to marry your date on the second date. That's tough. So we'll use so the only goal in day 2 with money and time is we're just going to ask for 3 commitments with money and time. We're not going to ask for weeks and months. And then we will continue the process, the 4-step process. We'll establish the need, the presentation, see? And then same with the patient education. Well, on day 1, we're starting to educate the patient on the 3 phases of healing. We'll start with the inflammatory phase. Day 2, we'll educate them on the repair phase. Day 3, we educate them on the remodel phase. Real straightforward. Unbelievably simple. It's very easy and simple for patients to grasp and understand. It's not overwhelming them. And then, so on day 2, we've confirmed even more we can help, how long it's going to take, what it's going to take. We're only asking for 3 days of time and money, which is now much, much, much easier. And we've educated them on day 1, we did inflammation. Day 2, we finish on repair. So this relationship is taken off really well, and we're following all the natural purchase guidelines. We're following motivation, pleasure, logic, fear. We're following the 4-step purchase cycle. We're including the 4 most important questions along the way. We're stair-stepping them to increase the trust and confidence, decrease the defenses and resistance. In other words, the value is going up significantly as the defenses and the resistances go down. Now that's going to be very important when I introduce the obstacles of time or money. So that is the major. Now, in the next video, we're going to go into the single most important part of patient education, which is called third-party trust. That combined with the motivation are the 2 most important aspects of patient education and getting patients to stay and pay for care. We'll go into the formula, need versus time and money, and the multiple contacts. So that's what we'll go into in the next video training session. We'll see you on the next video training session of chiropractic patient education.